Science has evolved, and so has our understanding of estrogen and menopause care. For years, hormone therapy was surrounded by fear because of a black box warning. But this past November, the FDA initiated the removal of that black box warning, reflecting updated scientific evidence. Today, we're breaking down what that warning really meant and how hormone therapy can be used safely and thoughtfully for many women today. Joining us now is menopause certified nurse practitioner Julie Spencer. Welcome back. Great to see you.
Thank you. Thanks for having me.
Of course, you are a wealth of knowledge, and this can be a little confusing. Take us back to, it was 2003 when the FDA initially put that black box warning on hormone replacement therapy medications. Why did they put that on then, and what was it kind of trying to warn women about?
Yeah, so the black box warning is the largest safety against medications and such. And so it was put on after the Women's Health Initiative in 2002 was published. And it basically had some great concerns about safety for breast cancer, stroke, blood clots, and clotting factors. So with that, women immediately halted, stopped hormone placement therapy, and became very fearful of being on it subsequently.
Yeah, and here we are 20 years, a little over 20 years later, the FDA is now removing that black box warning. What is the new evidence showing and why they were able to do that?
Yeah, sure. I think, over the years they've done a lot more reflection of the study and found a lot of flaws in the study. They found that a lot of the women that were in the study were older and postmenopausal, with the average age of being 62. And subsequently, more research has come out, and they found that there is a timing hypothesis for starting menopause or for starting hormone replacement therapy before the age of 60 or within 10 years of menopause.
Yeah, I know a lot of women are out there going, yay, I feel better, because they were so scared, yet they were suffering with a lot of symptoms. Can you briefly just share what some of those symptoms are that women experience in perimenopause and menopause?
Sure. So hot flashes, there's a list of 70.
Yeah.
Hot flashes, brain fog, anxiety, night sweats, joint pain, all sorts of different things. And they found, though, that using hormone replacement therapy can help with that.
Yeah. Now, when we talk about hormone replacement therapy, what hormones are we talking about here?
So we're talking about estrogen, progesterone, and testosterone.
Got it. Okay.
And so estrogen, we have them here.
Yeah.
It can be delivered orally. It can be delivered topically, transdermally through the skin, or vaginally with rings, tablets, or creams as well.
Got it.
Progesterone typically is a oral capsule taken at night. Can be used vaginally as well. And testosterone, which is the big thing right now, it's not FDA approved yet, but it is administered mainly through compounded creams or gels.
Okay.
Also through pellets you can use injected into the skin or underneath the skin.
I was wondering, like, what's a pellet? And how do you, okay,
so those are absorbed through the skin. They're injected actually in the buttocks, but through the skin and absorbed over time, usually about 3 months. And then you can also give it intramuscularly, so an injection, so it's absorbed a little bit differently.
So a lot of options for women, a lot of different ways. What is the big difference? We hear a lot about BHRT, or biosynthetic? Is that
bioidentical versus synthetic.
Yeah, what is that?
So synthetic is mainly what is chemically made, whereas bioidentical is typically safer, and it's more what our body is made from. It's from our body.
I see. Got it. Thank you so much for clearing up some of that. I feel like we could talk for another 20, 30 minutes, because this is a big topic for a lot of women. Thank you so much for being here. We really appreciate it.
Yeah, you're welcome.
Yeah, okay. Women with questions or symptoms should seek guidance from a qualified healthcare professional. To contact Julie, visit juliespencerwellness.com, and you can follow her on socials at Julie Spencer Wellness. Thanks again.